Welcome to the Skin, Hair, and Nails lab session. I'm Carolyn Merriman, the coordinator of the course this semester. What you'll need for this session would be your lab manual, and so go ahead and get ready by opening it up to the Skin, Hair, and Nails chapter, particularly where you're going to be doing the write-up. And also you'll get out your course packet and go to the page in the table of contents that says Skin, Hair, and Nails Practice and Write-Up Outline. Those are the things that I will be demonstrating. For this exam, what are the skills that you need? You're going to need the skill of inspection and palpation. So come along with me now as I go to a patient and demonstrate the Skin, Hair, and Nails exam. I'm now going to start the Skin, Hair, and Nails exam with a patient.
Hello.
Hi, my name is Carolyn Merriman, and I'm going to be your nurse today. I'm going to be doing a skin, hair, and nail assessment. Could you please tell me your full name?
Yes, Lita Jones.
Okay. May I check your armband, please?
Yes.
Okay. May I call you Miss Jones or Lita? What would
Lita
you prefer?
is fine.
Okay. And would you tell me your birth date?
12/28/57.
Okay. I want you to know that I have just washed my hands, and I'd like to sit beside you if that's okay.
Yes.
Okay, thank you. Well, to do the Skin, Hair, and Nails exam, there's some history questions that I would like to ask you. So I'm going to refer back to them, but if that's okay. Have you ever had any past skin disease?
No.
Do you have any changes in your skin color or pigmentation, like the color of it or anything?
No.
Any sunspots?
No.
Okay. Have you ever had a mole that you've noticed has changed?
Yes, I had a mole taken off 2 years ago, but it was not cancerous.
Okay. Do you have any excessive dryness anywhere, like any skin that's really dry that flakes or anything?
No.
Any excessive moisture or sweating?
No.
Okay. Any skin itching? Any areas that itch at all?
No.
Have you noticed any bruising?
No.
All right.
Not unless I hit something.
Okay. Do you have a rash or have noticed any other kinds of skin lesions?
No.
All right. Are you taking any medicine right now?
Zyrtec.
Okay, that's for allergies. So nothing, but you've not noticed like taking medicine and then having a rash after taking the medicine. Have you had any recent hair loss?
No.
Okay. Any change in your nails?
No.
All right. Are you out in the sun a lot, like environmental hazards? You know.
I do some yard work on the weekends.
Okay. Do you take care of your skin a certain way when you're outside?
I don't always wear sunscreen.
Okay, well that's something I was going to ask you is if you use sunscreen or not, and certainly that's something to think about to help protect your skin. Well, what I would like to do now is to examine your skin and your hair and your nails, and so I'm going to be looking and then also touching with my hands or the back of my hands, but I'll explain things as I go.
Okay.
Okay, so let me just put my book aside for a second. All right, so what I'd like to do first is just look at the skin on your arms, and then I'll be looking at the skin on your legs, okay? And then I'll look at your hair and your nails. So to do your skin on your arms, what I want to do is have you, if you don't mind, roll your sleeves up. Okay, and if you don't mind rolling the other sleeve up. And then we'll go down to your legs in just a second. All right, so what I'm going to do is, if you don't mind just holding your arms out, I'm looking at the front side of your arms. Now let's turn it over. Excellent. What I'm looking for are any color changes, any moles, any lesions. I'm also looking for visible areas of dryness or excessive moisture. Now what I'm going to do with the back of my hands is I'm going to touch your skin. So I'm touching the top. Now can you turn it over, please? Touching the inside. What am I touching for? I'm touching for the temperature of the skin, the smoothness of the skin, the texture of the skin, and then also any kind of excessive dryness or any kind of excessive moisture. All right, everything looks good there. I'm going to look down at your hands also. Okay, and I'm going to come back to your nails in a few minutes, but that's part of skin. Can I now look at your legs?
Okay.
Okay. looking now, okay, what I need to do is just look at the top of your legs. All right, now what I want to do is look at the inside of the legs. Perfect. So inspection is first. Excellent. And then I'm looking on the inside of the legs. Excellent. All right, now what I was looking for were any signs, again, of lesions. There's a couple of veins that I see, so vascularity, a tiny bit of that, a little bit of a something that looks like some sun areas here on your skin. Nothing that would cause concern. Now I'm going to touch again with the back of my hands, touch on the top of the legs above the knee, all the way down with the back dorsal side of your hand, and now I'm going to go underneath and do the same thing. So she is warm and dry. Her skin is warm and dry. Excellent. Okay, again, looking down at your feet, and we will add some other parts to that later. All right, thank you. So that's your skin assessment. Now what I'd like to do is examine your hair. So what I'm looking for hair is I'm looking to see if you have any hair. I'm also looking to see if you have any lesions on your scalp or any bumps on your scalp. So to do that, I'm going to have you lean forward. Usually I would be standing up, but during this taping I'm sitting down. So I'm parting her hair, and I'm looking for her scalp, and I'm looking for any lesions or bumps. If I saw any lesions, I'd put gloves on. I'd put gloves on my hands if I saw any lesions on her skin as well. I'm also going to feel or palpate the scalp for any lesions. I'm noticing also, so her hair is I would look at the color. It looks like it's been treated, but I would say that it is, it's coarse, it's shiny, the color is brown and black mixture. It's distributed without any areas of baldness or alopecia, so it's evenly distributed on her head. And so I don't see any lesions or palpate any areas of lesions on her. Now the last part of this exam would be her nails, and so primarily we're going to focus in on the fingernails, though we can check her toenails too. So for nails, I'm going to look and see that her nails that she has nails on every nail bed, that her nails are firmly fixed to her nail bed, that the nails themselves are shiny and that they're clear. There doesn't seem to be any pits or grooves or lesions on her nails. And I also can see, I'm going to also have her hold her nails up. This is called the profile sign, when you hold it above your head or even with your eyes. And what am I looking for here? I'm looking for clubbing. So she has no clubbing or extra angle of her nails, which if she had clubbing, what would that be? That would be sign of respiratory compromise, perhaps, because that would mean she has poor oxygenation down to her nails. Now, as part in your lab manual, it's going to say do capillary refill at this point. It's also part of peripheral vascular. But if you wanted to do capillary refill, you would just press on the nail bed, and it would turn, as you press on it, it turns white, and then it should within instantaneously turn back pink underneath the nail bed. That means that capillary refill is less than 2 seconds. Certainly any capillary refill that doesn't refill back to the original color in 3 seconds, again, is a sign of compromise. You can do that on both sides, which would be bilateral, capillary refill, and also check for clubbing. But if clubbing is not on one side, it's not going to be on the other. So again, the nails were adheres well. There were no pits or grooves. There was no clubbing involved. And I can also look at her toes. Now, here's the problem is with her toes is that she has nail polish on her toes. So I really can't do anything as far as cap refill, even though you could probably press at the skin by the nails to do cap refill. No obvious signs, though, of any kind of clubbing on her toenails either. And so this is the skin, hair, and nails, and it concludes the exam. What I would like to also tell you, though, if you will look at your lab manual, is that even though we did a complete skin, hair, and nails exam, the part that you're going to need for the CCE, if you'll look and it says documentation, the only part that you're going to need, and I forgot to do one part, which I'll show you, would be the skin, look and look, touch and touch. Do that for the arms, and also look and look, and then touch and touch on the back, And then the other thing that you're asked to do is pinch a little bit of skin here for skin turgor. I'm going to just pinch a little skin right here underneath your clavicle just to check your hydration. And it went snapped right back, which means she has adequate hydration. That piece is what you'll need to do for the CCE.